Hi, my name is Dr. Erick Moll with the Airrosti Rehab Centers. Today we're going to talk about a very common musculoskeletal injury known as the calf strain or calf pull. We're going to talk about the anatomy that's involved with this injury, the common symptoms that are often presented with this injury, and also how does the injury happen? What is the normal mechanism of injury that's involved with the calf strain or calf pull? We'll transition into a little bit of the traditional forms of care that is currently available to patients, and finally we're going to be able to talk about the benefits that Airrosti has in being able to successfully manage these cases. Okay, we're going to use this muscle chart to understand a little bit more in detail the muscles or tissues that are involved in calf strains or pulls. And as we begin to take a closer look, we're going to notice that some of the structures don't only exist in the area of symptoms, but often are found above or below that area. So let's take a closer look. When we speak of an injury to the calf muscle, we're really referencing three structures. We have the larger of the three, best known as the gastrocnemius. This muscle starts from the heel and comes up behind the knee. The reason why it's most often injured is because it does have to function on two different joints. On the other hand, the muscle known as the soleus muscle, which is a deeper structure, sits down just below the gastrocnemius. This muscle is commonly involved, especially in runners. And then we have the plantaris muscle and tendon that runs along the inside of the lower leg. This muscle may not be involved as much in a calf injury, but when we start to look at the area that most patients present with symptoms, is they present with symptoms down here where all three of those structures actually turn into what is known as the Achilles tendon. This is why a calf injury or strain may mimic Achilles tendonitis, or what some patients may believe they have Achilles tendonitis may actually be a dysfunction within one of those three muscles because they present with symptoms in the same area in most cases. This is Sarah, our volunteer patient. Let's talk about how do these injuries happen. Let's go back to understanding what we talked about on the muscle chart. That gastrocnemius, the larger calf muscle, starts from behind the knee and it extends down to the bottom leg. So as it starts from behind the knee, comes back to the lower leg, forming the Achilles tendon, it inserts into the heel. This is important to understand because when we start to talk about the range of motion of that muscle, we start to see two joints involved. First being the ankle. That muscle and those other muscles are designed to point the toe or the foot away from the body. In reverse, healthy individuals that have normal dorsiflexion or pulling the foot towards the body sometimes have a decreased risk of injuring that muscle. Once we start to lose that dorsiflexion in the ankle, we start to increase our risk for straining those muscles in the back of the leg. The same for the knee joint. There's muscles in the quad, in the hip that will start to play a role in how that knee functions. And if we don't have a proper function in the knee, we're going to start to strain that same structure. How does that happen? Typically when we walk or run, we're going to have an extended leg as we plant our foot on the ground. As we extend that leg, we start to stress the tissue that's involved, being the gastrocnemius or the soleus muscle. Now let me remind you, this muscle is not just involved in runners. It can also be involved in maybe a more sedentary lifestyle, and the reason why is because the two joints that we're talking about are involved. And so it's important to remember that if you have the injury and you're going to have it evaluated, you have to make sure that structures above and below that tissue are being evaluated. Once we've found out where the cause is coming from in your injury, we're going to spend the time addressing those structures. So the primary goal is to manually correct that tissue so that way we can fix the problem. We combine the manual therapy with some rehab so that way you can spend the time outside getting yourself back to what you want to do. In doing so, you'll spend less time in our office and more time doing the things you enjoy. Thank you for watching this video. And remember, if you have any symptoms similar to what we've talked about today or are dealing with a current calf injury or pull, please don't hesitate to contact us and schedule an appointment. We'd be more than happy to see you. Once again, thank you for watching and have a great day.